Hello everyone. In this video we're going to be talking about Gilbert syndrome. So let's start. So what is this syndrome exactly? So it is a condition where the liver processes bilirubin at a slower rate than normal. Generally, if a person has this syndrome, he is not going to present with any symptoms during his life. We are going to see in a while when are these symptoms going to be seen. So the cause of this syndrome is a genetic variation in the UGT1A1 gene. This mutation leads to a decrease in the activity of UGT1A1. We'll see what that is in a bit. Now let's see the genetic side of this and pay attention here because previous year questions have come from this topic. So there can be two type of mutations seen. If there is a mutation in the promoter molecule, this disease will be inherited as autosomal recessive. But if missense mutation is seen, this disease will be inherited as autosomal dominant. So there was a previous question which said that autosomal dominant pattern of inheritance in Gilbert syndrome is associated with which type of mutation? So the answer was missense mutation. Now what is the pathophysiology behind this disease? Let's understand this. So this is a hepatocyte and you must be knowing that from the blood, unconjugated bilirubin enters the hepatocyte to get conjugated. This process of unconjugated bilirubin being converted into conjugated bilirubin is done with the help of an enzyme called as UGT1A1, the one we were just reading a while back. Now we just saw that this enzyme is not working in Gilbert syndrome. Now tell me, if this enzyme is not working, what is going to happen? The levels of unconjugated bilirubin are going to increase and going to lead to the symptoms. So what are these symptoms and when do they occur? So these symptoms mainly occur after a stressful event, like if a person does very heavy exercise or drinks alcohol, suffers from some kind of infection, or even after heavy menstruation, some symptoms can appear. But usually there are a lot of people who have this syndrome and do not even realize that they have this mutation in them because it is not that severe of a disease. So what are the clinical features that will be seen? So there will be mild jaundice which will be seen as yellowing of the skin and yellowing of the sclera. This is mostly it. How are you going to diagnose this condition? So we can do a blood test which will show us unconjugated bilirubin levels to be high. But this is not a specific test for this syndrome because it can be increased in other conditions also. But we can do genetic testing which may be more specific where we can see mutations in the UGT1A1 gene. How are you going to treat this condition? So it is very simple. Just healthy lifestyle modifications will be enough for most of the people. But in some cases, we can even use phenobarbital. So what is phenobarbital? It is an enzyme inducer. So this enzyme inducer is actually going to increase the activity of UGT1A1. If this happens, the unconjugated bilirubin will now be able to convert to conjugated bilirubin and hence it will normalize the level of serum bilirubin and the symptoms will be gone. Let's end this video with a previous year question. A 28-year-old male presents with intermittent episodes of mild jaundice, especially during periods of fasting and stress. Physical examination is unremarkable except for a slightly yellowish tint to the skin and sclera. Lab tests reveal elevated unconjugated bilirubin levels. Which of the following enzymes is primarily deficient in this patient's condition? So to solve this question, we will first have to make a diagnosis and after that we will be able to answer which enzyme is deficient. So first of all, there is slight yellowish tint to the skin and sclera, so it is not severe. Secondly, unconjugated bilirubin levels are increased. And our final point which you should focus on is that these symptoms appear during periods of fasting and stress. So all of these point towards a diagnosis of Gilbert syndrome. And as we just saw, the enzyme which is not working here is UGT1A1 or uridine diphosphate glucuronosyl transferase. So our correct option here is option B. That's it for this video. If you have any doubts, so please leave them in the comments or you can message me on Instagram anytime. The link to my Instagram is in the description. Thank you.